is such a tough topic to talk about, but cancer of the colon is the second leading cause of colon or cancers in the United States, and March is the month that we talk about it.
That's right. We're so happy to have Dr. Raymond Moore from the Utah Gastroenterology Department here today. Thanks so much. We were talking earlier, and of course, Ann, your husband went through this.
Recently, just went through it, 38 years old, and it scared him. It scared him, yeah. It showed some of the signs. So let's talk about some of the signs. What happens here? And at 38 years old, that's pretty young to come up with some signs.
It is young, but I would say it's not uncommon. A lot of patients, while colon cancer typically happens in patients over the age of 50, in fact, 90% of colon cancers that are diagnosed are in patients over the age of 50. It can happen younger. With colon cancer, a lot of times by the time these patients start showing signs or symptoms, it's often too late and the cancer has progressed to where by the time you catch it, it's less curable.
What are some of the signs?
Bleeding, rectal bleeding, also abdominal pain, weight loss. Those are some of the more common signs or symptoms. But what's important about colon cancer is that it's something that is completely preventable, and our job and our goal is to actually catch these cancers and also catch polyps to remove them before they actually turn into cancer.
And we talked about the signs, but when you're saying that this is preventable, that means it's critical that people go get a colonoscopy before they even have signs.
Correct.
Because then you're at the stage that you can basically stop it.
That's correct. The way that colon cancers are formed is that they start off as abnormal growths of tissue called polyps. Those polyps, over the course of many years, actually grow up to become cancer. And so in addition to doing colonoscopies in everyone over the age of 50 to find cancer, we also do it to actually look for and discover these polyps and remove them so that cancer sequence does not happen. It takes many years for these polyps to grow into cancer, so we have a large window of opportunity to actually remove those polyps and prevent cancer from even occurring.
My husband, at 38 years old, they did find a polyp. So it's when you think about it, because you recommend at the age of 50, that's when they recommend at 50, is to start the screening process.
Correct, and you actually bring up a good point. Regardless, the average risk patient should get their first colonoscopy at the age of 50. However, if you have a family history of colon cancer or colon polyps, such as your husband, then actually what needs to occur is that his brothers and sisters, as well as your children, need to actually get their colonoscopy 10 years before that diagnosis. So
and every few years.
Exactly, and then every 5 years, as opposed to the average risk person who doesn't have a family history of colon cancer or colon polyps. If they do not have colon polyps, they will get their colonoscopy in 10 years, whereas your husband's family should get them every 5 years.
You know, I'm looking at some of the numbers you sent us, and it's every year 140,000 people are diagnosed with colon cancer. Let's take it back maybe 10 years, 15 years. You never even really heard about this.
I think that colon cancer may have stigmata. A lot of times people talk about a lot of different issues, but digestive health issues never really, it's not something you talk around the dinner table about. And so I think that colon cancer doesn't get a whole lot of press as some of the other cancers do. However, you know, like you said in the intro, it's the second leading cause of death among cancers
for
behind
both
lung
men
cancer.
and women.
No, you're exactly correct.
It doesn't have a gender specific there. This seems to be something that people go, oh, I'm going to put off, just like a mammogram. I'll put off. But you're basically saying, if you get it done and you're tested regularly, we can prevent a cancer. Second leading death in cancers, and it can be prevented. The push now for the month of March is definitely get it done.
Sure, and you know, March being colon cancer awareness, what we're trying to do is actually get it out in the public. Say this is common. Let's actually talk about it. Get in, get your colonoscopy, beginning at the age of 50, because this cancer is completely preventable. You know, if you catch it in the polyp stage, you remove it while the patient's asleep, and they have cancer essentially cured while they're taking a nap, as opposed to, you know, having to undergo chemotherapy because of certain cancers. But it's also important to catch that cancer as soon as possible, because the earlier we catch cancers, the more curable they are.
I'm so glad that you brought that up, because let's talk about the process itself. I think it's scary when you think about, oh my gosh, I have to get a colonoscopy, oh my goodness. But you're under. It's the prep process that might be a little bit dicey, but you're put under. You don't feel a thing. You
Sure.
wake up, and then things
Sure.
are okay, hopefully.
No, actually, when I bring patients into the endoscopy suite, one of the first things I tell them is, congratulations, the hard part is over. All you have to do is take a nap, wake up, and we'll be done. And so the day before, the bowel cleanse is actually, probably the more challenging part. But at the same time, by the time you actually get to the endoscopy suite, the procedure in and of itself, patients are completely asleep, don't recollect anything about the procedure, and wake up and they have a chauffeur take them to lunch.
There you go.
Much. All right, if you want to know any of these ideas that we talked about, any of these points, of course, we'll have them on our website right there at abc4.com/goodthingsutah. Remember, March is colonoscopy and colon cancer awareness month. Please also give them a call and make an appointment. Do this for your loved ones, do it for yourself. And like Dr. Moore said, this is totally preventable, so please take advantage of that. Thank you so much for coming and
Thanks
talking
for having
about
me.
this
Good
with
to have
us.
you, Dr. Moore.